Why is sputum smear grading important for TB? Imagine trying to understand how serious a problem is just by looking at it. In tuberculosis, doctors do something similar with sputum samples. They look at the sample under a microscope to see how many bacteria are present. This is called sputum smear grading. It's a simple, quick, and affordable way to get important clues about the infection. The more bacteria they see, the higher the grade. This helps doctors figure out how contagious the person might be. If the smear shows a lot of bacteria, it means the person is more likely to spread TB to others. That's why grading is so helpful in controlling the disease. Sputum smear grading also guides treatment decisions. If the initial test shows a high bacterial load, the patient might have more lung damage and could respond more slowly to treatment. Doctors can use this information to plan closer monitoring or more intensive therapy. It also helps in tracking how well the treatment is working. When the bacteria decrease over time, the smear grade drops, showing that the treatment is effective. If the bacteria stay high, it might mean the treatment needs to be adjusted. This ongoing assessment helps ensure the patient gets the best care possible. Another reason why grading is important is that it reflects how severe the lung damage might be. Higher bacterial loads often mean more extensive lung involvement. Chest X-rays can show this damage, but the smear grade gives a quick idea of how serious the infection is. This helps doctors understand the stage of the disease and plan the right treatment approach. Public health efforts also relying on sputum smear grading. Quickly identifying highly infectious cases allows health workers to isolate patients and trace contacts. This reduces the chance of TB spreading further in the community. It's a key tool in stopping outbreaks and protecting public health. While sputum smear microscopy has some limitations, like missing cases with low bacterial counts or in patients with HIV, it remains a vital part of TB diagnosis and management worldwide. It's especially useful in resource-limited settings where more advanced tests might not be available. Combining smear grading with other tests helps build a complete picture of the disease. In summary, sputum smear grading is essential because it measures how many TB bacteria are in the sputum, indicating how contagious the person is. It helps predict how the disease will respond to treatment, shows how severe the infection is, and supports efforts to prevent transmission. Always remember, if you or someone you know is being tested for TB, consulting healthcare professionals is the best way to get personalized advice and care.